the type 2 supplemental pill that I'm taking has been working in reducing my blood sugars and basically maintaining a lower blood sugar count, which I quite favor. $160.
Okay.
160, and the time is. Hello, my name is Robert Lynch. I'm 84. I'm a diabetic. I've been a diabetic for at least 20 years. I initially acquired diabetes from having 3 pancreas attacks. The first one was in '79. I'm not quite sure when the second one was, but the last one was in 1992. That's an estimate on my part. We're checking to see what the actual dates would be. After that, my doctor, who was Dr. York at the time, thought that I had damaged my pancreas, and he then gave me a urinalysis test to verify it or to at least identify the fact that I had diabetes. And then he went to a blood test and found formally that I was a diabetic. He then started me on the standard diabetes treatments, metformin, glipizide, and the other drugs. I was on the drugs for quite a while, and unfortunately he decided to quit his practice, moved to Santa Maria, and became a resident doctor. And I then searched around and found another doctor. He has been my doctor since then, and he has followed my case for at least 15 years. Unfortunately, the medication that I was taking did not satisfy the requirements for keeping my blood sugars low. We started then on the insulin treatments and other treatments, but primarily insulin. It was Lansing that I was taking. Started out initially at 10 units. It now has grown to 26 units. And also we still are on the regular medication, the metformin and the glipizide. Then along came Randy Ziegler, who offered to let me take a supplement, which I started on that about 26 days ago or 27 days ago. And over that span of time, I have dropped down to the point where I am not taking any insulin. I've dropped metformin, and I am also reducing the amount of Victorza that I was taking. I'm still on glipizide, but a half a unit as opposed to a single a single unit per day. I take it back 2 units per day. I'm down to 1 unit per day, and I'm feeling very well. As a matter of fact, during this whole period of time, I also monitored my diet. I was very cautious about what I ate, and still retained my outside regimen of golfing, walking the dog, and getting as much exercise as I possibly could. Over the period of time, the charts that I prepared here will indicate that I'm down to 0 insulin take in it. Will reduce my insulin take in. I'm sorry, that's not a very good term. Reduce the intake of insulin to 0 on the 19th of this month. This is March 19th. And I'm now 1, 2, 3, 4, 5, 6, 7 days without insulin, and my readings have been with the exception of a couple times, fairly normal and well within the range of the values that I had while I was on all the other medication that I was taking, particularly the insulin. And I personally feel that within another couple of weeks or so, I'll be down to reducing the number of pills that I'm taking, this supplement, from the 6 that I'm averaging now per day down to maybe 2 or 3. And also my values of blood sugar will also drop during that span of time. Just the indications from the or the results that I have obtained from taking the pill have been miraculous as far as I'm concerned. And one of the side effects, which is a very positive one, is that I feel I have more energy. I've lost some weight during this period, which has also helped help my metabolism and my well-being as well. And I just really am very positive about the type 2 diabetic supplement that I'm taking, and I'm more than happy to see other people get a chance to do the same thing, because I feel it will enhance my quality of life, and I will not be injecting myself twice a day like I was doing during that period. And it's troublesome to do that, and I don't necessarily like it. And I'm pleased that I've stopped doing that at this particular point in time. And that's about all I have to say, except that I can strongly recommend the type 2 supplemental pills that I'm taking. In all this hen scratching, as you can see here, is very good results.
So
frankly.
4:30, you took 2 pills right there.
Right, and then I put 4:30 also. Well,
Right.
4:30 was the blood sugar.
Right.
And
160, and then 4:30.
and then
you took
2 pills at 12 o'clock, so 4 hours apart.
Right.
And then I had another
What time did you eat lunch?
pills, ate lunch at 12:30.
Okay. What time? How many minutes?
It's been 1 hour, 1 hour since I
Oh, 1
took
hour.
Yeah, 4:30, 5:30.
Okay.
So it's time to take my blood again. Run a check. Yep, I didn't quite do it. Happens. There we go. Ooh, there it comes. Measuring. $132.
Hmm.
You like that number? I like that number very much. The type 2 supplemental pills that I'm
Show the
taking.
camera. You're looking at.
Yeah, you look at it. You're the
Here,
star
Bob,
boss.
if you're the spokesperson, you don't do this.
Yeah.
You do
No,
that.
I was looking at the words underneath the type 2 RDDT.